has a family member who had colon cancer at age 50 or younger is at increased risk for colon cancer. So if you have a parent who develops colon cancer at age 80, that alone doesn't necessarily increase your risk for colon cancer, and you can have your normal screening starting at age 50.
Now, for example, let's say I have a brother who had colon cancer at age 50, but not my parents. I am still at increased risk.
You are at increased risk, and the recommendation would be to first talk to your brother to consider genetic testing to try to identify a specific mutation that might then allow other family members to be tested. So, for example, there's one syndrome where we have identified the specific genetic abnormalities, and you can actually just order a test to check the genes, and if your brother who has already had the cancer has that particular genetic abnormality, then the other family members can be tested for that abnormality specifically to identify whether they in fact also inherited the same predisposition for colon cancer.
So this testing would be available at your office or any surgical oncologist's office? Or?
Yes, correct. Usually what we do in patients with increased risk based on a family history, we send them actually to a genetic counselor to review the rationale for genetic counseling and then to actually do the testing if the patient wishes to proceed. Now, without the genetic testing, everybody in that family should consider their first colonoscopy starting at age 40, or what we usually say is 10 years before the youngest cancer in the family. So if someone has a cancer at age 40, the siblings and children should get screened at age 30.
Okay. Now, in people whose parents get it at age 50, what if they get the cancer, but they're a long-term survivor? They're still at risk, so they still should be screened.
Correct. Survival from colon cancer is related to stage. And so if you have an early colon cancer that's picked up, then you have a high survival rate. But if it was picked up early in life, that does have an associated increased risk for the family members.
Okay, so then what about all the fancy testing that you can now pay $600 to Google and all the various companies, and you can get all your DNA tested? So if you think you have a colon cancer or a genetic component, should you do this through your doctor's office or just pay your credit card and just go through the web?
I don't think there are any data to suggest that random genetic testing will be of any benefit in identifying patients at increased risk for cancer. I think that those types of studies will be very valuable as we learn more and more. But currently, submitting everybody to genetic testing with the tests that we have available in the absence of a strong family history has very, very low cost-benefit ratio.
So the take-home message for our home audience is have colon cancer screening at age 50, no matter what. And if you have any symptoms, it's no longer screening. It is diagnosis, and that your insurance will pay for it. And if you have persistence of these symptoms of bloating or change of bowel habits or blood in your stool, follow up with your doctor and ask for more aggressive screening. What else would you like to tell our home audience?
Well, I think for patients with colon cancer, surgical treatment is the primary treatment, is very effective for early colon cancer. If you're at a more advanced stage, then you should make sure that you're being treated by cancer specialists so that you have availability to the newest advances in modern chemotherapy as well as other very sophisticated techniques to deal with metastatic disease.
And that there is hope, and that because of the new advanced diagnostic techniques, that people don't have to wait till they have severe symptoms to seek help, and that they can be cancer survivors and do well with colon cancer.
And preferably just prevent the colon cancer by appropriate screening and early detection of polyps.
Thank you, Dr. Bastidas, for joining us on colon cancer and advances for its treatment. We hope you come back and talk about other exciting advances in surgical oncology. And to our home audience, thank you for joining us at KSAR at Health Talk. And if you really like the show, send donations to KSAR, Saratoga TV. And Dr. Bastidas is in private practice in the South Bay area at Good Samaritan Hospital and other local areas, hospitals, and his phone number is on the back. And thank you for joining us on Health Talk.